I know you all want to know what the payers have to say because that's how you make your livings. Great. We're actually going to do this as a true panel, so I'm going to move over to the table and we're going to go ahead and get started here. Okay. My name's Don Bradley, and I'll be the moderator for this panel. We have a great resources today. My left is Sissy Kraft, who's the Regional Vice President for Anthem, a family physician by training. Next is Darshak Sangvi, who's a pediatric cardiologist by training and practice, but has great experience with CMS, and we'll be talking about the data and return on investment pieces. And then we have Anand Parekh, who is with the Bipartisan Policy Center. He's their chief medical advisor, and he will talk about the kind of the policy work that the Bipartisan Policy Center is doing around obesity services. I'm going to start us off with just a quick overview. We've heard a lot of comments about how payers think and how we work. Myself, I spent 26 years as the Chief Medical Officer at Blue Cross Blue Shield in North Carolina, but I have become a relapsed academician, returning to Duke about 3 years ago once I retired from Blue Cross. So, first point I want to make is that services for obesity are mandated under the Affordable Care Act, period. There is a hook there. I think that anything that is United States Preventive Services Task Force recommendations A or B are covered. These are they up there related to obesity. And thus and they relate specifically to screening activities and to actually doing intensive behavioral counseling. So there is a hook. There are a couple of caveats to that. Not every health plan is actually subject to the mandates of the Affordable Care Act. So you kind of have to look at that. And the second is that these guidelines aren't very specific in terms of how a health plan is to provide those services. So it's there, but it's not real clear overall from a regulatory standpoint. I thought it was in finding the benefits. So I actually looked in I actually put the nutrition and physical activity benefits into Blue Cross Blue Shield of North Carolina over a decade ago, and I actually had to go look to make sure they were still there before I could talk to you guys. The member booklet is 77 pages long. The benefits are scattered in 2 different places. One on page, I forget, I'll show you that in a second, but you can look in the benefit books. That's one place. You can look under the preventive care guidelines, because again, USPSTF will come under preventive care guidelines. You can look in the wellness programs. We heard a little bit about that earlier. And finally, for things like surgery for severe obesity, that's going to be in the medical policy. So you do have to kind of hunt a little bit. The other piece of looking for where the benefits are is every state has its own essential benefits. So when you're kind of trying to look about how the benefits are to be provided, you need to figure out what's the benchmark plan for essential benefits in that state. In North Carolina, it happens that we go to the most prevalent small group plan in the state. That happened to be Blue Cross Blue Shield of North Carolina, so I know a lot about that. That's great. I was fine. If you're in another state, it really varies on what the benchmarks are. So I said I had to go find them. The red is those few lines in 77 pages of our member handbook at Blue Cross Blue Shield of North Carolina of where we find it. We cover, and have for over a decade, we cover 6 visits to a nutritionist for either weight maintenance or weight loss. We cover 4 physician visits, and then we cover the obesity surgery. And if you look in the formulary, we also cover the drugs. But you do have to hunt and peck to find the coverage. The key, I think, is thinking like a payer if you're trying to figure out what's going to get covered or not. And it's the first thing that determines coverage from my perspective is what does the customer want? The second is the cost, just flat out cost, because that determines what the premium's going to be. How predictable is the cost? We heard about that. There's evidence for efficiency and effectiveness. Can the services that you're going to cover provide outcomes? And then do we have a network to deliver it? We also have customer satisfaction, whether we can administer the benefit. And I'm going to let Sissy address that kind of thing. There's compliance and mandates, and then what are the risks? And finally, and really the last consideration is profitability and margin. I think that's where most healthcare professionals think that the health insurance companies are really after profitability. There are at least 9 other things that they're looking at. So with that, let me turn it over to Sissy.